Understanding the human mind. Wow, and all its challenges, it can feel incredibly complex, can't it?
Oh, absolutely. It's just a space filled with so many perspectives, theories, personal experiences.
Yeah, and the field itself is constantly evolving, often, with conflicting ideas about how we even define things, let alone diagnose or treat them.
Exactly, and that complexity, that's precisely where we're diving today.
We are. We've got this collection of source material, shared excerpts, really offering a unique and, well, in some ways, a pretty challenging perspective on mental health.
hmm It hits on diagnosis, treatment. It even questions the very definition of mental illness itself.
It does. And this material, it's kind of a mix, isn't it? There's personal viewpoint observations that maybe touch on some research findings, but definitely some very strong opinions on mental health care today.
For sure. Strong opinions.
So our mission for this deep dive is basically to unpack these sources. We want to pull out the most important insights from this specific viewpoint, mind you.
Right. Highlight maybe some surprising claims.
Yeah, and help you, our listeners, navigate this particular material. The goal is really for you to be better informed about these complex issues, but, through the specific lens of these sources we were given.
Okay, let's do it. So the foundational idea here, the source seems to argue it's really crucial to acknowledge mental health issues exist. But, and this is key, it cautions against immediately slapping on a label without, like, a deep understanding first.
That's a really interesting starting point. It's not saying ignore the problem, far from it. It's about how you approach it.
Exactly. And the source makes this strong claim that a key step towards getting rid of any issue is actually learning to accept that you have an impairment.
Right. It suggests the real problem often isn't even the label itself, but the refusal to accept the issue exists. And that refusal can come from, well, professionals, patients, anyone really.
Yeah, that idea of acceptance, it
Yeah.
pops up again and again. And building on that, the source really emphasizes looking closely at symptoms.
Not just like analyzing the mind in general.
No, it says you need to scrutinize the diagnosis by paying extensive attention to the symptoms. It even suggests treating each symptom separately at first.
Okay. And the source, it's pretty critical of what it sees as, let's say, conventional treatment.
Oh, very critical. Especially professionals who it claims rely too much on medication instead of what it calls effective treatment.
It points out risks, right? Like with ziprasidone.
Yeah, it uses that as an example, noting the effects on the central nervous system. And it says, people with depression or learning disabilities should be particularly careful, according to this viewpoint.
And tied into this is a really powerful argument for listening intently to the patient.
Yes, it says it over and over.
Yeah.
The patient often knows more about their condition than the professional. Why? Because they're living it.
So simple, but profound. It really pushes for listening to what the patient is actually saying, not just hearing what you expect to hear.
Exactly. So, okay, that's the core philosophy. Acceptance, focus on symptoms, skepticism of some methods, listening to the patient. How does this perspective play out with specific conditions?
Well, it touches on anxiety and depression. For anxiety, the source observes that clients often seem to strive for attention, which it finds interesting because it sees that as contradicting antisocial behavior.
Okay. And for depression?
It claims depressive individuals might actively seek answers, but then maybe disregard them when they find them.
That's a challenging observation.
It is. And interestingly, the source links depression to spinal and nervous system issues, suggesting things like exercise, healthy eating, natural herbs could help.
Right, more holistic approaches again. Now, schizophrenia. The source has a particularly strong, almost urgent tone here.
Yeah, it states cases are increasing and it requires immediate treatment, full stop.
And it lists the symptoms we often hear about. Paranoid thinking, paranoia itself, hallucinations, voices, suspicion.
But then it brings in this specific idea of a 20-year area of the brain being impacted, claims the mind is sort of broken from reality.
And because of that disconnect, it views affected individuals as a potential risk to themselves and others.
Which is why, according to the source, medication is deemed necessary in this specific case to prevent episodes.
Right. It even uses the Oklahoma bomber as an example of what it terms a paranoid schizophrenia episode. And it acknowledges, scientists are still struggling for answers here. Genetics, disruptive childhoods are mentioned as possible factors.
And controversially, it views schizophrenia as permanent. Often it says due to a lack of understanding, which it then links to these larger twin holes in the brain cavity.
Yeah.
It also says denial just makes treatment harder.
Okay. Moving on to bipolar disorder. The source describes this one as common,
Yeah, and links it to what it calls a mere chemical imbalance, which it suggests comes from a lack of valuable nutrients.
which is a specific take. But it also argues that childhood experiences, unaddressed trauma, these are often overlooked root causes behind that chemical imbalance, the things leading to the mood swings.
So not just chemicals, it does acknowledge recent studies linking bipolar to genetics and family history, though.
And the treatment goal,
Mhm.
from this perspective. Effective methods, but without over-medicating or causing psychotic breaks. It does concede that medications can help reconstruct chemicals.
Got it. Then we have cognitive disorders. The source points to memory loss as the common thread here.
Yeah, and things like dementia, delirium, alcohol-induced disorders, it links them to brain disease, biological illness, alcoholism, chemicals. Pretty broad categories.
Symptoms often involve problems with speech, thinking, judgment, recognition, things like that.
And it makes a point that sometimes anxiety, inflammation, or fear can actually lead to these cognitive issues being misdiagnosed as bipolar.
Oh.
So be careful there.
Right. It clarifies delirium specifically affects awareness, causes confusion, has physical symptoms too. And dementia, it presents as a type of Alzheimer's, basically, leading to memory, learning, language disabilities, often from chronic issues.
And the source is very clear about alcohol. Strongly advises against it for anyone with mental illness symptoms. Says it just increases disruptions.
It classifies alcohol-induced disorders like Korsakoff syndrome under this cognitive umbrella because of symptom similarity and the substance link, although it's careful to say not all mental illness is substance-related.
And it connects nutritional deficiencies, especially B-complex vitamins, to patients dealing with alcohol or drugs. And again, that theme, acceptance is key to healing alcohol addiction.
Okay, let's talk personality disorders. The source groups quite a few conditions here. It briefly mentions adjustment disorders, basically, problems adapting to stress.
And sexual deviation.
Yeah.
It links that to pornography abuse, behavioral issues, brain impairments, mentions a possible genetic link for serial killers, psychopaths, but disputes it's always tied to child abuse.
Right. Then it dives into specifics. Antisocial personality disorder. It describes it as a refusal to associate.
Links it to abuse, substances, crimes, sex deviations. This is potentially genetic, maybe linked to brain injury or ADHD, considers it risky to others, often linked to homicides in this material.
And it claims it starts as conduct control disorder before age 18, but,
Yeah.
and this is interesting, says it can be managed with patience, lack of fear, time, effort, understanding, and hard love, as the source puts it.
Hard love. Okay.
Yeah.
And borderline personality disorder, BPD, described as impulsive, unpredictable mood swings, risky ones.
Yeah, links here to fear of abandonment, promiscuity, manipulation, self-destructive stuff like cutting or suicide threats for attention, sometimes violence.
The source says it's risky to live with someone with BPD, linked it to incest, family breakdown, substances, notes potential for short-term psychotic breaks, and again, often linked to homicides in this source.
Histrionic personality disorder comes next. Traits mentioned are vanity, narcissism, anger, being seductive, flirty.
The source claims they might play the victim, often have other diagnoses too. And worryingly, it reports instances of extreme violence, even murder, linked to this. Says they struggle to show regular emotions. Another one often linked to homicides here.
Obsessive-compulsive disorder, OCD. The description here is maybe not what everyone expects. It mentions disregarding rules, perfectionism, inability to finish tasks or be flexible.
And then a really provocative claim that they view people as objects, common in domestic violence situations, it says, though not always the perpetrators.
Wow. Okay. Alienate others, stingy, disregard feelings, may abuse others who show feelings, says they often look serious but force laughter, and again linked to homicides but described as killing slowly compared to others. That's quite a statement.
It is very strong claims. Then there's passive-aggressive personality disorder, sabotaging life, complaining about demands, passive outwardly, aggressive inwardly.
Angering others with obscure techniques, blaming others. The source notes it's controversial, disputed, but claims it's used daily in diagnosis. Also, a quick mention of self-defeating personality disorder associating with harmful people, excusing help, trouble with relationships.
And dependent personality disorder. Here, the source recommends long-term talk therapy, no medicine.
Root cause, it suggests, is fear from punishment, neglect, abuse, often in an unruly family setting, heavy reliance on parents, codependency.
The source believes the patient have the answers, but isn't aware of them. So treatment needs consistency, letting them talk freely, asking questions, but not letting them blame themselves.
Okay. What about dissociative identity disorder? Or DID formerly MPD.
This source links it very strongly to severe childhood abuse, highlights the distinct personalities, the alters different genders, ages, etc. Amnesia voices nightmares using we instead of I.
And it says it's difficult for experts to really grasp.
Yeah. And a surprising claim here. The source asserts that people with MPD-ID actively fight against lying, strive for accuracy. It uses this to distinguish them from what it calls common issues.
That's interesting. It also notes female sufferers are rarely violent, while male cases linked to crime are seen as acting out trauma projections and interjections, the source calls them.
Linked to eating sleep issues, too, and often described as creative, intelligent.
But treatment is tough. Years, potentially. Source claims therapists often avoid diagnosing it. Medical treatment is tricky. Blood rates, MRI, breathing rates can fluctuate between alters. Some might even be blind.
And integration in the process of merging alters involves reliving trauma, so it's risky. Patients can feel loss afterwards. But the source insists it's a real illness, despite controversies, criminals using it as an excuse. And medication often causes more harm here, it claims.
Right. Then impulse control disorders, common in kids, it says. Recurring symptoms that lead to poor judgment, harm. That's the sign.
Basically acting against your better judgment, often after feeling intense pressure build up.
It specifically highlights intermittent explosive disorder, IED. Describes it as potentially deadly if untreated, explosive behaviors.
Links it to brain aberrations, deems sufferers high risk, often with other underlying issues. It gives an example of a child with multiple diagnoses, IED, conduct control, etc. Even psychopathic tendencies told it was hereditary, no help available. But the source claims, no, it can be managed with patience and lack of fear.
Okay, another category, somatoform mental disorders. What's the focus here?
These seem to target fear. Fear of illness, fear of the body, medical issues. You get physical symptoms, but there's no clear medical explanation. The mental symptoms link the physical feelings to a perceived problem in the mind.
So ruling out physical causes first is crucial. Medical tests are needed.
Exactly. It mentions hypochondriasis, constant complaints, fear of being sick, and body dysmorphic disorder, BDD, anxiety, depression, OCD tendencies, this strong belief that your body is somehow malformed.
Sir says many are newer discoveries, not much info out there, but adds a warning.
Right. These can have risky trends if antisocial, OCD, or histrionic traits are also present. It claims these combinations can lead to killing if triggered. So thorough assessment is vital, according to this view.
Wow. Okay, sleep disorders.
Yeah.
Affects millions, it notes.
Yeah, includes things like sleepwalking, nightmares, insomnia, sleep-wake schedule problems. Recurring symptoms mean it's likely a disorder.
Linked to physical issues, stress, other diagnoses, substances. Pretty wide net.
Insomnia specifically gets linked to focus problems, depression, anxiety, low energy, disrupted REM sleep. Shift work is given as an example trigger.
The source offers some personal solutions. Healthy eating, stress relief, one day at a time, mindset. But stresses treat the underlying issues first.
In sleepwalking, another really striking claim here, says it can be deadly. The possibility of murdering someone without even knowing.
Seriously.
That's what the source claims. Links it to high stress, PTSD, MPD, where trauma exists. Says sleepwalkers can appear zombie-like. Nightmare problems are tied to PTSD. Trauma, too, seeing real-life horror, screaming, night sweats.
While sometimes linked to physical disabilities, the source suggests most sufferers have other issues, trauma, substance abuse. Finding the root cause is key.
Lastly, for conditions, it covers postpartum depression, PPD.
Right. Describes women feeling sluggish, unconnected, depressed, uncontrollable, crying often without cause, irrational thinking, tangled emotions, sleep problems.
Feeling guilt, maybe resentment towards the birth or the child.
The symptom list is long. Sadness, despair, worthlessness, insomnia, panic, shame, fear of losing control, racing thoughts, nausea, agitation, racing heart, breathing difficulty, fear towards the child, hopelessness, exhaustion, even suicidal thoughts.
The source suggests there's often an underlying impairment, biological imbalances, maybe PTSD from a difficult birth.
Treatment is usually antidepressants plus therapy, and the advice is clear. Seek help immediately. It affects the whole family, the child.
Triggers mentioned include difficult births, separation, death, big life changes, genetics, money problems. Writing, talking can help. Regular checkups recommended.
It even mentions specific meds, Valiums, Prozac, Zoloft. Family support is vital.
And an interesting point, the resentment might be towards life circumstances or the birth event itself, not necessarily the child. recommends music and exercise for relief.
Okay, wow. That's a really comprehensive rundown of conditions through this particular lens. Now, let's shift gears a bit and look at the source's critique of the system and treatment in general. It doesn't hold back.
No, it really doesn't. It repeatedly criticizes professionals making some very strong claims, like many aren't qualified. They focus too much on money or insurance.
It uses the term entrapment remedy, right? Suggesting wrong diagnoses for financial gain.
Yeah, and claims they over-medicate, assume they know more than the patient, lack training for complex cases, and use the guinea pig method, just trying stuff out.
So, because of this deep skepticism, the source really pushes for patient empowerment.
Absolutely. It urges individuals, urges you listening, to research your own symptoms, behaviors, diagnoses. Question your therapist. Ask about symptoms, the diagnosis, the meds. Don't just accept it without understanding.
Taking notes is helpful, it suggests. Maybe get family involved to assist.
And the DSM, the Diagnostic Manual, gets heavy criticism too. Calls it just a manual, not factual truth. Says the codes are mainly for insurance, and it changes constantly, making it unreliable for, real understanding.
This brings us back to labeling. It's complicated in this source. Earlier, it cautioned against quick labels.
Right, but later it acknowledges that once you are labeled, people might only see the label.
However, it still maintains that accepting your impairment, your disorder, your imbalance, whatever it is that is the critical first step in recovery. It says it's okay to state your diagnosis while you're working on getting better.
It's a nuanced position. There's also a strong theme of systemic errors and blame. The source points fingers at professionals, the system, for mistakes, wrong diagnoses, bad meds, overlooking physical causes.
But then claims they often shift the blame onto the patient or blame defective teachings in their own field.
Yeah, avoiding responsibility, basically.
Yeah.
And the medication critique comes back hard.
Effexor XR specifically.
Yes. Strongly links it to serious side effects if stopped abruptly. Suicidal thinking, impulsivity, violent outbursts, increased blood pressure.
It gives a detailed example, right? A patient supposedly misdiagnosed, overmedicated, whose problems got worse because of the prescriptions, and claims these errors happen frequently.
And building on that, the source suggests alternative causes for what we call mental illness. Maybe it's an underlying medical problem or a nervous system interruption.
It even brings up chiropractors, suggests working with the spine, which connects to the brain, might be helpful but is often overlooked. Contrast this with mental health experts giving drugs that, it claims, cause worse symptoms like psychosis or schizophrenia.
It's definitely proposing unconventional pathways. Beyond the treatment system itself, the source also looks at external factors. And some of these claims are, well, highly controversial.
Like the link to the criminal justice system.
Yeah. It claims the root of criminal behavior actually starts with the justice system's own violent history, flogging, beating, what it calls twisted theories. Argues criminals are inspired by this violent example.
That's a very provocative statement.
It is. And it also expresses frustration that many mentally ill people end up incarcerated just because nobody listened or helped earlier.
The source also points to entertainment's role.
Certain films, music, reading material, specifically pornography and violent media, are linked here to mental ailments and violent or criminal behavior, murder, rape, drug use, disrupting lives.
It gives an example of a young man claiming song lyrics, "Kill your mother," influenced him.
While it admits not all entertainment is bad, the message is stark. Associate with bad, you bring bad. And says everyone, except maybe newborns, is exposed indirectly.
Societal factors are in the mix too. Culture, history, law, religion, all listed as influences.
Yeah, it touches on how society or law might label people who don't conform as mentally ill. And denial again. Says it's rampant in political groups, religious groups, society, law, blaming others, not taking responsibility.
Which leads naturally into how this source tries to define mental illness and even deviance. It acknowledges the definition varies wildly.
Right. Says social scientists swap mentally ill and disorders, and reiterates the DSM is unreliable for definitions because it's always changing.
It challenges that view, sometimes found in criminal justice, that mentally ill people are only homeless or in prison. Says no, they're in all walks of life, all professions.
And then offers a provocative definition. From a certain societal angle, mentally ill just means not conforming to the group's thoughts, beliefs, actions.
Nonconformity as illness. Denial comes up again, too. A common trait in mental illness, yes, but also claims it's rampant in professionals and society who blame others for errors.
Then there's this idea. Ill minds think alike. Suggests people can be influenced by external stuff or even by other people with mental illness leading to shared struggles.
But crucially, it argues patients actively seeking help are not the ones in denial. It's those making excuses or denying issues in others who need more help themselves, according to this source.
Yeah, it claims many experts are tangled in their own issues, miss patient insights. Patients know more because they live it. That's the core belief.
The source also talks about mental illusions, how the mind can play trick suspicion, losing your train of thought, can't articulate. Says if it's ongoing, it could signal a problem.
Discusses delusional disorders, like persecutory types feeling people or systems are out to get you, cheated, mistreated, or grandiose types believing you're superior, powerful. Explores how these differ from or overlap with schizophrenia.
And uses that illusion idea for personality types too. Histrionic playing roles, shifting moods, needing focus, narcissistic grandiose, self-promoting, lack of regard for others.
And maybe the most challenging point, who is the real deviant?
The source suggests, controversially, it's often the professional trying to make patients fit into norms. People who just follow rules, think alike, sees this forces people to be someone they're not.
Finally, it touches on this abstract idea, the mind outside the mind. What actually determines if someone is mentally ill or not?
Suggests it's when the thinking process is off balance, especially if there's a physical link, but acknowledges, hey, the mind can play tricks on anyone, even the sane.
So wrapping this up, trying to summarize this deep dive into a really challenging source. The overall message seems to be, understanding mental health means looking way beyond the usual labels and approaches.
Yeah, it hammers home listening to the individual, considering underlying physical stuff or trauma, and recognizing how much societal systems and external things, justice system, media, influence, everything.
It takes a very strong stance. Bold claims, really. Professionals make errors frequently. Medication is often harmful or misused. The system's flawed. And maybe most fundamentally, patients often get their own struggles better than the experts do.
Absolutely. And that leads us right to a final provocative thought for you, the listener, based purely on the source's perspective.
Given these claims that patients know more, that acceptance is key. What happens when it's the professional who might be in denial? Denial about their own limits, maybe denial about the patient's truth as the patient sees it.
And thinking about it from this unique viewpoint, what responsibility does this perspective place on you as an individual navigating your own mental health journey, or maybe supporting someone you care about through theirs? Something to think about.